There it goes. Okay.
Question 1. I guess I'll go ahead and read it.
Yeah, sure.
By the stakeholders in the versus Charleston Community Memorial Hospital case. Basically, I looked up what stakeholders the definition was, and it just said like patients and then like anybody really involved in the situation. So
Yeah.
the kid himself that broke his leg, and then like his father, since he's underage or a minor, and then Dr. Alexander, and then like the nurses he worked with. That's what I said.
I also said Dr. Reynolds too.
Yeah. I wasn't sure if we were supposed to include Dr. Reynolds because he was with the different hospital.
Yeah, I wasn't sure either, but I was like, maybe just because he did provide care too, because like he did recognize like the issue that was going on with the leg. So I don't know if it could fall on him eventually, but
yeah, true.
Yeah, I said the same thing. I said the patient who was a football player who hurt his leg, the dad, the doctor that obviously casted it too tight that made him lose his foot, and then like the nurses in the room. I also added like the Joint Commission would be at stake as well because they're the ones that accreditate the hospital.
Yeah.
So
yeah,
I thought in the long run, they would get like hit by this as well.
Yeah, I can see that, like a fine or something.
Right, because they provide the accreditation for them.
Yeah, I overlooked it. So.
Yeah, I don't know.
I didn't have that,
but
no, you're good.
Yeah, so I just anyone who's at risk. I really think that's about everyone. Probably like maybe the head of like whatever department could be as well.
Yeah, but it never listed it, did it?
Yeah.
So.
No, I mean I'm just going off at this point, but when it comes to the case study, it'd probably just be like really the patient, the doctor, the dad, possibly the Joint Commission, because I know that they talked about them a little, and the nurses and everything.
That would be terrible to go like for a small thing and then end up like having your whole leg amputated. Like,
right.
I can imagine.
That's what happens though when people don't know what they're doing.
And it sucks with like in the medical field, like stuff is like so extreme, like
yeah,
that is like a possibility. It sucks.
Right, you're just going to cast your foot. It kind of sucks because who knows, like he's probably one of those football players who wants to go to college or football and stuff, and like, can't really do that if you have a leg amputated.
No, literally, I would be so mad.
Such a bummer for sure.
Okay, question 2. Identify a hospital-based program designed to improve the quality of care. One example is Yale New Haven Hospital's Ruby Slipper program, which is designed to protect high-risk patients from falling. You may choose to search the database of your university or library to find the quality safety program. Summarize the program and include an explanation of why and how it illustrates stewardship. One program I found was it was a Johns Hopkins Hospital at Home program, which obviously, like the name is pretty self-explanatory, just provides care for people at home that are struggling like to get out. They're not always mobile or their health's real bad, so it's inconvenient to have to go to the hospital to receive care. And it's typically did I say it's typically for the older population?
I mean, you can kind of generalize.
Yeah, that's what I said. And then
susceptible for that.
And it just provides hospital level care in a patient's home, and it's a full substitute for acute hospital care. So it just kind of cuts out all the extra hassle with it, and you kind of get a one-on-one experience. So you get better patient care. It also helps reduce cost and, like I said, improve the patient experience. And it has been proven to lower rates of mortality, delirium, sedative, med use, restraints, and lower average length of stay. So, and like reduce costs by like almost 30%. So I feel like that's a great program that illustrates stewardship because it not only makes it more convenient to receive care, but also you don't have to worry about the bill you're going to get. And a lot of countries overseas already have this implemented. And it said that if many of our like hospitals did it, we would see a lot improve with like Medicare and Medicaid and all that too.
Yeah.
Yeah, that's pretty cool that like they can get care at, at home and they don't have to be stuck to a hospital bed.
Mhm.
That they get to be at home.
And it's very like, because like even with especially like fall risk people or like really poor health, like even like traveling to the hospital is not really easy on them. Like it's kind of stressful situation, and walking into a big hospital, unless you're like a frequent visitor, then it's probably a little more frustrating, the check-in process, all that.
Yeah, and then like you mentioned, like Forest, like my mind just goes to like my physical therapy background, but like when they get care at home, if they have like physical therapy or occupational therapy or something, then they can learn how to be about in their home safely instead of like being up in the hospital walking, even though that's not their normal setting. They have to
Yeah.
go back home and relearn how to do like these skills by themselves at home. If
Yeah,
that
for
makes any
sure.
sense. They're getting that care in the hospitals or in their home instead.
Yeah, I had a friend, his dad he has lung cancer and he's older, but he did like kind of both. So he went to the hospital too, but because he had cancer, so he obviously had to
Right.
do like have machines and stuff for his treatment, but he would do like therapy at home, which was like nice because he would only have to go to the hospital every 2 weeks, which is a lot easier to manage than
Mhm.
because they usually need someone to tag along with them and stuff and like help them make sure they're understanding like everything that's going on and stuff. And it was nice to see him like be able to do like his little band exercises by himself, because they like the older you get, obviously you need more help, but you're still an older person, so you don't want to feel helpless. So it's nice that they can at least like implement it at home where they can kind of have control over their recovery process as well.
Yeah.
Yeah.
I think it's definitely a very good thing to have and implement at hospitals because some people definitely need it.
Mm-hmm.
Okay, so I did a hospital in Florida, Mount Sinai Central Hospital, Miami, Florida. So they have this like program implemented. It's just called Lose the Tube, and where they're focusing where like catheters are being used when catheters shouldn't be used, like to with machines and stuff like that. It was like causing a problem with like UTIs and stuff like that. So they focus on reducing the amount of catheters they have to use on patients. And like if a patient truly doesn't need one, then they're not going to put a catheter in a patient, and that just reduces the risk of, well, not only like waste of using a catheter, but like reduces the chances of receiving a UTI, which is really nice because one, no one wants to get a UTI while they're in the hospital, like no. And then that just kind of increases their in like hospital bills if they get a UTI, because now they got to treat for the UTI, something they didn't even have when they came in. So that just shows good stewardship, like why are you going to give you something that you didn't even have when you came to see us for something completely different?
Mm-hmm.
I agree. And it's like nice because not only is it they don't have to get extra care on top of what they're already there for, but also like they can the fact that they can notice that, hey, we're probably doing like this is something we could probably cut out or figure out a way to make sure our patients are having like a good experience. Because if I'm going to the hospital, I'm hoping that I don't leave with another ailment because of something they did.
Yeah.
Well, and then that just adds on the like medications that they have to spend money on to treat it, or like that just adds on to hospital bills. Like, oh, you came in for this, but we're adding this much more money to the bill because we have to treat you for this, something you got while you're staying here.
Definitely would be super frustrating because like you weren't before that, and then it happened because they messed up.
Right.
And in our country, we have a bad problem. Like a lot of people like don't get care because of like the cost of things. So anything we can do to help like reduce it is a good thing.
Yeah. So I chose Cox Hospital, and I just was kind of like looking through what programs they had, and they have an injury and safety prevention program where they offer free education for the community and like schools and workplaces. um, and they do it for all ages of school. And for each age groups, they have like different like trainings. For K5, they have like bike and helmet safety, and seatbelt safety, and like pedestrian safety, because a lot of kids are walking to like not necessarily walking to school, but when they're like on the campus, they're like walking around outside and there's like cars and stuff. So just trying to be like safe for them. And then for like sixth and eighth grade, they have things like risky behavior training, which is like recognizing bad choices so they can like prevent later like situations not happening. And then for like ninth and 12th, one that I recognized was like safe driving, because that's the age that you're going to start driving. And then for adults, they have things like home safety, for like their children, car safety or car seat safety for like their children as well. And then like one that I recognized was safe baby like training. So like common infant injuries, and then like being safe with your baby in the car, with their sleep, and then like when you're holding them, like how to hold them properly. So it's just like free education for the community to help them with certain things that they may not know about.
Yeah, that's awesome.
And is
Well,
that
I mean-
that's like through the hospital?
Yeah, they offer it through the hospital. I think they have like this like seminars where they have them come, where people come in and you can just like listen and stuff like that.
Oh, that's cool.
And they also have it online as well. That's where I found it. So
Yeah, that's
Sorry
nice
to,
because
I didn't mean to
a
cut
lot
you
of
off.
no, you're good.
But yeah, no, that's nice that it's also online because not a lot of people could probably like travel that distance, you know.
And go out of their way. And it's really like, I'm in another class where we talk about like like how I don't know, like social problems, but really just like problems in general. And
Yeah.
like you said, like teenage driving and stuff, like there's an increase of accidents and injuries among like the teenage population, obviously, because like they're the newer drivers. And like
Yeah.
I think educating more on that would be like, take it more seriously, because obviously you're excited when you're young first driving, but
Mhm.
you're also driving like a big
Yeah.
like you're driving a big like machine, so safety is important. And
Yeah.
also like educating the youth about like how you said the K-12 or whatever, about like pedestrian like etiquette, whatever, is good, because like they don't really know how to respond to situations like that, and like they
Mhm.
usually freeze up or they feel like uncomfortable when
Yeah.
something like a car is like coming and they don't know if they're supposed to cross, whatever. But starting younger is the best way to help like change the society or the culture around that kind of stuff.
Yeah.
I know, I totally agree. I mean, like even driving towards campus or whatever, like, you know, people are like trying to cross and like, you go, no, you go, and like you both go at the same time. Right? Just knowing, just like let them go and then just be done with it.
Or like people just walk out in the street, which it's like, I'm glad I'm paying attention, but it's like, dude,
Mhm.
like I know
Yeah,
you
happens all
are
the time.
no, like I know you're supposed to be like, you can cross, but at least make sure that someone's stopping. Like you can't
Yeah.
just walk out in the street.
Mhm. For sure. So I feel like this case study was a little bit shorter than the last one.
Yeah,
Yeah,
not very hard at all.
no, it was pretty good. Okay, I'm gonna stop this recording.